So we partner with a country for up to 5 years, and so we will work with them for 2 years in advance, looking at their medical systems and how we can best partner with that nation. Then for 10 months, our crew will come in with a ship and deliver over 2,000 surgeries. They'll see 15,000 dental patients, and they'll train about 1,500 medics in the country. And so that's what we're doing today in Conakry right through to the summer.
And how often do you get out and about and see the work firsthand?
Yeah, so I personally go out once or twice a year to view what we're doing and see how it's developed. But what we've got on board are this volunteer crew who are really the guys in the front line who are giving up their time, their careers to go and do that. So we've got a captain who runs the ship. We've got a chief medical officer. We've got people that have served for 5-10 years at a time, giving up their skills. So they're the talented ones. My job's just trying to, keep it ticking over.
And I'm guessing sometimes the crew may find themselves in difficult situations because some of these places that you go to may be somewhat unstable.
Yeah, there are huge challenges all across the coast of West Africa. I mean, West Africa had over 16 sets of elections last year with new presidents coming in across the continent, with the majority of which were great for the countries that are in. But a change of regime, a change of circumstance can cause a lot of upset and disruption. But because we're there by invitation of the president and the Ministry of Health, working alongside the World Health Organization, we look after our volunteers to try and make sure they're in the most stable environment they can be in.
So really what you're providing is healthcare that would cost hundreds of thousands of pounds in those sort of situations. And we're talking about a branch of a local business that supports the work you do. I mean, that must be vitally important.
Yeah, the cost, if you were to try to build the facility that we've got on board the Africa Mercy, this hospital ship, if you were trying to build that in each country we went to, we'd be spending tens of millions of pounds and leaving behind something that isn't necessarily useful for the country because the skills aren't there to utilise that. So by bringing a mobile platform, this ship that can sail in and access all the healthcare that's required, it's a much more cost-effective model. And so partners like Thomas Miller are a huge impact in being able to fund those surgeries.
Well, I'm delighted that we are joined by Neil Birchenough and Ian Young from Thomas Miller here in the Isle of Man. And Neil, I have to come to you first of all, because you are doing a fundraising challenge. I think it's in July, isn't it? You are cycling the 300 miles from London to Paris. What I love about this is you're not really that into road cycling anyway, are you?
Not at all. Never cycled before on a road bike.
Right. So how did this come about then?
Again, it's just trying to raise money for Mercy Ships. So Thomas Miller have pledged £150,000 over a 3-year period and challenged the staff to raise that same amount. We have 850 employees worldwide, 60 of which are on the island. So we're trying to do our bit to raise as much money as we can. So we've got 11 people in total taking part in this ride, 4 of which are from the Isle of Man office. So we're looking to raise around £1,250 each, and small donations from anyone will help reach that goal.
I believe you've actually got your target now, haven't you?
I have, yeah. Others not quite there. But if there's anybody wanting to donate, then they can get in touch with Thomas Miller and make them donations.
And Ian Young, are you taking part in the cycle?
I'm not doing the cycle,
No, thought I'd give that one a miss.
Yeah, I thought I'd give this one a swerve.
Yeah. You and Neil are both on the Corporate Social Responsibility Committee for Thomas Miller. So this notion of CSR, incredibly important to the business. Can you just explain what it actually means for us?
Yeah, I think CSR for Thomas Miller, we launched a new CSR initiative last year, which is when we had a survey of staff members. And there was 3 charities that came into our global headquarters in London, and Mercy Ships were the charity that were successful. So we launched a big CSR policy there, and it also involves not just the charitable donation for the likes of Mercy Ships, but it's also trying to get employees to engage with how we interact with the planet, how we interact with our suppliers. So it's a huge, wide-ranging kind of initiative that's in place, and I think to date in the Isle of Man we've trying to reduce our sort of single-use plastics. Mm-hmm. We sort of partnered up with staff to buy water bottles and lights and things like that. So it's just a huge opportunity for Thomas Miller to do things better, I guess, and for their staff to do things and get really engaged.
And it's a great mentality to have, because actually each of the employees are given so many days, aren't they, that they can donate to a good cause. How does that work?
Yeah, so each staff member has up to 3 days a year that they can use to charitable endeavours. We've used Manx National Heritage. We've partnered up with the Manx Wildlife Trust. We've done Breakfast with Santa for Crossroads, which is like everyone likes to get involved with that one. And we're on the lookout for any other charities that would like some volunteer and assistance over the next 12 months.
So if someone's listening and they think that they could take advantage of this, then how does it work? What would they do?
Hey, okay, I'll take this one. I think if they can get in touch with Thomas Miller initially, and they can point it to myself or Neil or to other members of the charity committee locally, and then we'll sit down, we'll look what we can do with them. If it's a big project, then great. I know other companies have done it. I think working plantations and things like that. So it's just a case of get in touch with us if you've got any plans. We're always on the lookout, and we really want to get our staff out there. It's a day out of the office for staff members. It's really helping local charities.
And we don't mind manual labour.
Oh yeah, it's just a brilliant concept, isn't it?
There was 5 of us down at Cregnish last Tuesday. The Manannan's cloak had descended. It was a bit grim, but it was a really good day out. Everyone enjoyed it. I'm not particularly arts and crafty, and then ended up making wicker baskets, which we'll see what the outcome is, whether the hens get to. We were helping to replant a medicinal herb garden, which was just fantastic because you get to learn lots about things that you wouldn't necessarily know about. So,
oh well,
really
Neil,
good.
I'm intrigued to know how the training for your cycle then is going.
I've now been on 3 cycles.
Right, that'll do it.
Yeah, the latest was last night. I live just off Bray Hill, and I went down Bray Hill, off towards Peel, and then up Cronkavody, and it felt all the way to Kirkmichael and back to Peel, and it felt like 60 miles,
And
but
how
it
many
was only
miles?
20.
Oh,
My wife was supposed to meet me in Peel at 7 o'clock, but she said it was too late to bring my son down, so that I then had to cycle home, which was only another 10, but felt like 40. So having done 30 miles, I felt sick when I got home. I felt terrible this morning. But the first day's race on the 24th of July is 90 miles. So I've got an awful lot of training to do in a short amount of time.
it's that whole thing though, isn't it? When people do things like marathons, I mean, half of it is a mental challenge, isn't it? You don't need to do the whole distance to be
I
able to do
couldn't
it.
tell you because I've never done a marathon.
Okay,
I'm,
right.
I'm
Just trying
very
to make you
much
feel better.
short distance, no
Giving
stamina
me a
based
lot of
sports.
confidence here, Neil. A lot of confidence.